Hello all, this is Melissa, and this video is how to set up your endoscope for a procedure. First of all, you'll see here all the endoscope tower, as well as the slave monitor. And just to show real quickly where you hook up your cable. The cable is right here, a circle. It says eBus, but that is where you hook the slave monitor up to. And the cord is always attached to the back of the scope, and it's usually hanging right here, so it should always be there. So in our kits that you'll open and put on top, and I put a couple of extra, one here, and I also have one down here. You have the cleaning brush, which you will not use. That's for us. You have some 4x4s and some lube. And then this is your basin, and you can put still water, you can put tap water in it. Tap water is appropriate, especially now since we're on a sterile water shortage and allocation. So regular tap water is fine. So this right here is our scope storage area. And just to open this up, the first cabinet is the gastroscopes. And let's see, we have standard colonoscopes in here. And then this cabinet is pediatric colonoscopes. And then bronchoscopes are in the last cabinet, but you guys never use those. So you want to choose your appropriate scope wearing gloves. And then we have the liners that go into these basins that are right here next to the scopes. They're hanging here. So you would want to place your scope in there, as Michelle is demonstrating. And then this comes with a green and a red cover. You want to put the green cover on, indicating that it's a clean scope, and save your red for after. Okay, you are now set up in your room, and Michelle will bring the scope over and show how to assemble everything. Okay, now we are going to assemble the water bottle. And this tubing has two functions. It is, you need it for scope insufflation, as well as washing the lens, and for irrigation through the endoscope. The buttons, you have a biopsy port, you have the air water, and you have your suction. And you'll notice in this pack, there's this extra button that we'll talk about when you're done with your procedure. Yep, and then there is the connector. This part is going to go on the scope, and it is a anti-reflux valve, and it's so bile burden would not reflux back into the tubing. Okay, the tubing is loaded, and if you'll see, the soft part goes into the roller. And you want to note that this portion right here, just get it close to that. And that's so when they step on the pedal and they step off, it doesn't continue to flow out of the scope when they don't want it to. And then you'll also notice you're going to have this extra piece that you're not going to connect to anything. You can just clamp that off, because that is for CO2, which is not on this cart. So this part of your water bottle, it just connects like this, just kind of pops right on there. Okay, so prior to use, we want to turn everything on, make sure everything's working, and you want to make sure that your scope is working properly, that it's insufflating air. And that's what you want to see, is those nice bubbles. We're not gonna be able to test suction because we don't have suction in our room. You also want to check and make sure your irrigation is working, as well as your air and water. Just one little troubleshooting feature: if you don't have air, make sure your air is on down here, because sometimes this can get knocked, or you can hit it and go to standby. So just to do that, you turn it right back on. And we always have the air on high. That's just normal for endoscopy procedures.